Hello, how are you?
I'm good. How are you?
I'm all right. It's the United Kingdom. It's dark. It's raining. It's very cold. So,
Often so nice.
yes,
Perfect.
yes. Anyway, good morning, afternoon, and evening to everyone, wherever you are in the world. Thank you to USERN for inviting me to share my work. My name's Helena Lee. I'm an associate professor and honorary consultant ophthalmologist at the University of Southampton and Southampton General Hospital. And I'm going to be speaking about oral levodopa, that rescuing retinal morphology and visual function in a murine model of human albinism. So first of all, for those of you not familiar with albinism as a condition, albinism is a group of congenital disorders of melanin biosynthesis characterized by hypopigmentation of the skin, the hair, and the eyes, and the fundus. It's also characterized by this involuntary rapid to and fro movement of the eyes called nystagmus. And you get visual impairments. So many people with albinism are registered as sight impaired. Part of the problem in albinism is an abnormality of retinal development, or what we term typical foveal hypoplasia. So if you think of these as highly focused cross-sectional images of the retina, on the left is a 3-year-old control, and on your right is a 3-year-old patient. All of these different layers are basically, think of them as different layers of neurons and cells connecting everything across the retina and then eventually transmitting it to the brain. The light comes in from the top and the retinal pigment epithelium is at the bottom. And as you can see in the normal 3-year-old control, the center of it is pinched. So if you think of it like a sandwich that's pinched, that's normally developing retina. In the 3-year-old patient, the patient with albinism, you can see that there is a visual abnormality here at the center. The most obvious thing here is that these inner retinal layers, which should have moved apart, are still present in the central retina. You can also make out that the outer retinal layers are the photoreceptors, the cells that are responsible for processing light signals, are less well developed in the 3-year-old patient. So in order to understand how we treat this, we need to understand what normal retinal development consists of. And there are 3 phases to this. You've got the migration of the outer retinal cells into the central fovea, so migration of the photoreceptor cells into the central fovea. You've got migration of the outer retinal layers outwards from the fovea, and you've got elongation of the retinal cells over time. So what I'll do is I'll play this video again, and what we've done is color-coded it so you can see what is happening with the inner retinal layers, which are colored in blue, and the outer retinal layers colored in orange. This is data, in vivo data gathered from almost 300 infants, young children, adults, using in vivo OCT imaging, or the optical analog of ultrasonography, to monitor what is happening with retinal development over time. So I'll just play this again so you can kind of process what is happening across time. And the important message here is that retinal development doesn't stop at birth. It is continuing in early infancy and childhood. Okay, so I'll just play that one more time just to make sure you've had enough time to process what is happening with normal retinal development. Okay, so the next question is, in our albino patients where the retina looks like it's not developed normally, has this stopped, or does this continue on in early infancy and childhood? Is there a window that we could potentially target with treatments to help normalize retinal development and therefore normalize visual function? So how does the retina develop in albinism? So on this graph, what we've done is plotted the thickness of the foveal outer retinal layers on the y-axis and age in months across the x-axis. Each of these points represents a single OCT examination, with the red indicating albino patients and the green indicating normal controls. And what you can see here is prior to about 18 months of age, there is a rapid development or elongation of the foveal outer retinal layers in normal controls. There is a similar degree of development in the albino patients, but they never quite reach the same level as the normal controls. But what this does indicate is that there is this period prior to about 18 months of age, which we could potentially target because the retina is plastic, it's still developing. So can we modulate postnatal visual development? So yes, we can, and we've known this for hundreds of years when we've been treating amblyopia or lazy eye using patches and glasses. So what is the equivalent of treating lazy eye in albinism? And in order to understand how we target this, we need to understand a little bit about the biochemistry behind albinism. So this is probably the most complicated slide I have. So we'll run through it slowly. So in the melanin synthesis pathway, you start with your basic amino acid tyrosine. And this is converted to DOPA using tyrosine hydroxylase and the tyrosinase enzyme. The tyrosinase enzyme is necessary for subsequent conversion of DOPA to pigment. So that is your melanin synthesis pathway. But if you take that away, so you take away tyrosinase, you've got a failure of tyrosine to be converted to DOPA and subsequently to pigment. But DOPA also has other roles. So it is converted by DOPA decarboxylase to dopamine, and it also acts itself on directly at the OA1 receptor. And this acts to modulate retinal development. And this has been proven in mice. So on this graph at the bottom, you have on the x-axis the concentration of DOPA in the eye of the mice. And on the y-axis, on the x-axis, you've got the age in days, and on the y-axis, you've got the concentration of DOPA. Blue indicates pigmented mice, pink indicates the albino mice. And what you can see here is that in the normally developing mouse eye, you have DOPA increasing in concentration up till about 28 days, 29 days of age before beginning to level out. And in an albino mice, this never occurs, okay? So this would seem to point to DOPA being a key molecule in modulating normal retinal development and visual function. And interestingly, this peak here between birth and 28 days of age matches the therapeutic window that we've seen in our own data in normal in vivo retinal development in humans. So can we target this? And I wondered, this is the question. My slide is just frozen 1 second. If we could use something that we already use to treat Parkinson's and infantile dystonia, and levodopa carbidopa, to help normalize retinal development. So in order to demonstrate proof of concept for early postnatal DOPA treatment in albinism, we conducted some animal experiments. So we took three different groups of animals, a normal pigmented C57 control mouse and an albino mouse, which was the equivalent of OCA1 in humans. And we treated them with L-DOPA 1 milligram per mil dissolved in their drinking water from birth, from 15 days of age or 29 days of age. And they had a total of four weeks treatment with this. We examined the retinal development and function using OCT, or the optical analog of ultrasonography, and ERG, which is like a retinal EEG that detects retinal function at the cortical level. And we did this at 4 weeks of age, 5 weeks, 6 weeks, 2, 3, and 4 months of age. And I'm just going to show you what, this is an example of an OCT being taken from a mouse. So we get quite a very high detail images using this OCT imaging in vivo. Okay, so let's open that. And the idea of that is that if we could confirm proof of concept in these mice, it would be the first step towards the development of clinical trials for human infants with albinism. So this is an example of an ERG result. So for those of you not familiar with ERG results, the amplitude is displayed on the y-axis in microvolts and time in the x-axis. The more negative your A wave and the more positive the B wave, the better your retinal function. And on this graph, you're going to see what I've shown here is control albino mice who haven't been treated. So this is a group of 9 mice. And this is a group of 10 albino mice that have been treated with L-DOPA from birth. And what you can see here is quite a dramatic result where you've got a significant increase in the amplitudes of the A and the B waves. We've also shown that this is actually maintained up to 3 months of age, and that it is effective in mice treated from birth and 15 days of age. In fact, it seems to be more effective for 15 days of age. And it is not effective after 28 days of age, which is what we expect when we look at the normal levels of DOPA in the developing mouse eyes. It should peak before 28 days of age. So treating them after 28 days of age is after that period of retinal plasticity. We've also been able to correlate structure with function. So this is a bit of a complicated graph, but essentially what you've got here is your amplitude of your A and B waves, again on the y-axis. And what you've got this time is that you've got the length or the thickness of the retinal layer along the x-axis. We have color-coded the controls and each of the groups that have been treated with DOPA from birth, 15 days of age, 28 days of age, are different colors. And as you can see, there is a correlation between the treated L-DOPA groups and retinal nerve fiber layer length, outer plexiform layer thickness, outer segment lengths, end tips of photoreceptors lengths, and retinal pigment epithelial thickness, and the A and B wave amplitudes. So we can definitely see effects on both structure and function using levodopa treatment in these albino mice. Then we also went to examine this using human equivalent doses. So we calculated how much based on surface area the mice need to get to match human equivalent doses that are currently used in things like infantile dystonia. So we worked out the equivalent of 0.76 milligrams per kilogram, which is a typical dose for humans. And what we show here is what its effect on the amplitudes of the A and B waves. So again, the amplitude is on the y-axis and age is on the x-axis. And each of these different colors indicate several of the human equivalent doses that were tested. And what we have in the clear box is what an untreated albino mice would look like. And what we have here in gray is a normal control C57 mouse. And what you can see here is that each of the human equivalent doses seems to increase the amplitude of both the A and the B waves to near normal C57 levels, which was very promising. Now, I thought it'd be nice to show a video of a treated mouse. So a normal mouse with oculocutaneous albinism, essentially blind. What we do with this test is these little stripes. It's the same response that you get in infants. It's a reflex where you want to follow stripes. And if you're able to see stripes, you will move your head. The finer the stripes that you see, the better your visual function. Now, a normal mouse looking at these stripes will probably stand still on the pedestal because they can't see anything. But what I'll do is I'll show you what's happening with this mouse. We just blank the screen. And just you can see the mouse is very interested in what's happening around it. And just watch this now. Keeps going, chases the stripes around, nearly falls off the pedestal. So it's really quite cute. So what that test is an optokinetic visual response, and it's done with the optometry machine. And we can do it in clockwise, counterclockwise directions, up and down directions. And again, we use the similar color codes. So again, different human equivalent doses. And again, we've put in an untreated albino in the blank, and in the gray, AC57 control. And as you can see, each of the doses that we test brings the visual function close to the normal levels of the C57, with obviously the medium high level doses having a more sustained effect on all directions, clockwise, counterclockwise, up and down. So to conclude, treatment with human equivalent doses of levodopa, while there's still residual potential for retinal development, normalizes retinal development, optimizes vision. We're still optimizing, conducting dose optimization studies. I'd like to acknowledge the entire Leicester research group, where we conduct the normal in vivo retinal development work in humans, and the entire Olivia study project team, where we've been working on the levodopa treatment.